Dr. Adnan Kisa is working as Professor of Health Policy and Economics, and is Pro-Dean at the School of Health Sciences, Kristiania University College, Norway. He is also holding adjunct professorship positions at Tulane University and University of South Carolina. He received his doctorate from Tulane University School of Public Health and Tropical Medicines, USA. Dr. Kisa has an extensive global health and policy research experience focusing on health administration, health and economic development, health services utilization, comparative health systems, cost of illness, cost effectiveness of interventions in healthcare, and health outcomes research, all covering almost all areas related to health. He has more than 150 peer-reviewed published articles, books, book chapters, research reports in health policy and economics. He is member of many international health institutions, scientific boards, and editorial boards. Dr. Kisa was the principal investigator of the Turkish National Burden of Disease and Cost Effectiveness Project, which was funded by the World Bank. He is also the principal investigator of the project on leadership and communication styles of country leaders in the novel coronavirus outbreak project. I think that will be an interesting area. We'd like to hear from you, the project was funded by Kristiania University College. He's also a collaborator for project on global burden of disease, Institute for Health Metrics and Evaluation at the University of Washington, Seattle, USA. He is associated with various WHO World Health Organization projects also, like WHO Innovative Care for Chronic Conditions Project, WHO Adherence to Long-Term Therapies Project, and WHO World Health Surveys. He is also associated with the Value of Vaccination Research Network at the Harvard University. So that again will be an interesting area if you could touch on that. Dr. Kisa has received numerous awards and recognition related to teaching, research, and service throughout his career. So welcome again, Dr.
Okay, thank you very much. I wish I had a chance to be with you in Jaipur right now, but there is no opportunity because of the travel restrictions. I had a chance to visit your university and another university in year 2011. So I am very familiar with Jaipur. It's very lovely city, and I had really good memories over there. Thank you very much for this kind invitation, Dr. Gupta and Ms. Sharma and Ms. Osha. And I am ready to take any questions. If you have any specific thing for me to start, so please let me know because I have many things to say. Thank you.
Start with your profile. So while Tulsi and I were researching about you stalking you on LinkedIn and other social media platforms, we found a lot of your research articles and everything. So first we would like to start about, as you have achieved a PhD, would you enlighten us about the topic of your PhD and why you exactly chose that topic itself? Because we found it really interesting.
You want to study something that's very specific, and you want to study something that first time it will be handled by you. Therefore, you must be reading a lot and make research. And at the end, you need to come up with some kind of unique, very interesting idea to focus on your doctoral dissertation. But I was thinking that I have one good opportunity because I was taking my doctoral study in the United States. So it was very easy to reach some data because the registry system in the United States is better compared to, for example, Turkey, for example, compared to some developing countries. And when I look at the literature, I saw that the health outcomes were measured by very limited. Try to understand what happens if US adopts Canadian healthcare system. What would be the outcome by adapting health inputs from Canada and calculate the results for the United States? The vice versa, what happens, for example, what would happen if Canada adopts the US healthcare system and use the similar type of health inputs, health inputs means, for example, hospital beds, number of nurses, number of doctors. This crisis was requiring different approaches to handle it and to give some different communication. I always do my research open and open access. I always do, so many people can easily.
So,
Single,
yeah, please
yeah,
continue, sorry.
single man-run countries are having difficulty, and countries run by the right-wing governments are having difficulty, and countries led by coalitions are very successful because coalition requires consensus. So it is very important to convince all parties, third parties, and you must come with a common decision, should be widely accepted by all people. Because compared to other infectious diseases, some country leaders were saying that, for example, in the UK, Boris Johnson was saying that herd immunity can work. Actually, this is very different disease compared to others. For example, let me share two countries that I know very well right now. One is Norway. Norway is a small country, and people were following suggested guidelines very closely. And even though the majority of the people didn't wear any mask when they go to the crowded places, but many people worked at home. Home office activities were very common at the beginning of the this corona case, and online teaching for different schooling, high school, universities have been widely used. But for example, when I come to United States, I saw that, okay, when many people are live in highly crowded homes, and they need to go to the work by using public transportation, they must go. Because right now, many countries are saying that we will not use the approach of lockdown, because it's a kind of a choice between keeping people healthy, and also you must continue with your economic activities. So it's a kind of balance that you need to think. So I think economic part is now more important compared to the health part, because you cannot lock down the whole country, all activities. Economically well-developed countries, especially if those countries are welfare state-oriented countries, in terms of economic activities, they can, provide some additional financial support for their citizens. But the other countries, they have nothing to provide. So the economy must be kept open. This is the reality. So countries with a good welfare state system and with high income, was mentioning some underreporting of
Yes, so that
COVID.
was my next question itself.
Yeah.
That you have published an article on underreporting of COVID-19 cases in Turkey, and you had also mentioned about other countries.
Yes, because why people need underreporting? Why country leaders need underreporting? When I look at Europe, free press in your country, it is really difficult to hide those realities. What I see that the countries with low democracy index level and freedom of speech and other development indicators were hiding more. And the countries compared to previous years, you can easily identify it. And some countries still, the physician associations are very, very enough infrastructure to deliver those courses online, for example. Then you can have a good system, but some professors are not ready to use this high-tech or even though basic technology in terms of teaching. Good supervision from your professors, because you will send an email message or ask in the virtual classes the answers for, if you have any questions, the answers that you will get or you may get, it will be very limited because the classes are very crowded right now, especially in social sciences, for example. Of course, in the health area, you need to go to a practical practice places such as hospitals, primary care centers, whatever facility you need for your course. And those facilities will limit the number of visits and also a number of teaching. And now some companies and some institutions in the higher education system developing very cost-effective teaching materials for the students. And even those, you can also experiment some, for example, in chemistry, in physics, you can make some experimental studies online, but still you cannot touch the microscope, you cannot touch the other devices that you need to use in your learning. Another problem is because the universities will not be the same. For example, some countries' income, if you look at the share of education sector, for example, really depend on the international students. For example, in the US, in the UK, in some European countries, because of the corona cases, those countries are limiting student visas. So they are not, providing additional student visa for those students who want to come and get their education in those countries. So it's a kind of income loss also for those countries, because international students pay higher than local students if you look at the tuition fees. So they're also losing their income. Another issue, for the government universities, local or national governments can provide some kind of financial assistance for the institutions. And for the students, take courses in the government institutions. But for the private institutions, many private universities, if they don't have very strong, have been shrinking. This is the reality, I can say. So, but it doesn't mean that you cannot find a job. It will be very competitive. And because of this unemployment in different sectors, those people will be also seeking job for different thinking way and teach you how to learn, how to reach references, how to reach people. Your alumni office are very important in terms of connections with this industry. And you must be very, very practical. And therefore, internship opportunities, externship opportunities, capstones opportunities are very important. If you complete your internship in a good facility or company or government institution, for example, you will have more opportunity compared to those students have limited opportunities in terms of completing your internships. So internships are very, very important in here. And I also encourage all business administration students, finance students, or students in the social sciences, try to seek job opportunities outside of India also, because so I was having the difficulty, but I also learned many things from the US healthcare system and try to teach my students and my research assistants some benefits that they may use or opportunities they may use in Turkey. So it's a good idea to healthcare system. These are the countries that Turkey is trying to understand their primary care healthcare system and also their referral chain, and also try to understand how to keep people more healthy by providing primary care services and public health care services for the people. So it's difficult to say that we learn a lot from the US health system, but good to know, especially if you are trying to implement private hospital system and different healthcare delivery systems, alternative delivery systems. Yeah, good lessons that we learn, but these are limited compared to other countries, the lessons that we learn. Yeah.
There is another question from Pravesh Sharma. According to you, which sector will shine brighter post COVID-19? Which sector will shine brighter post COVID-19?
Yeah. I always suggest my students to read the developments in different fields. I read an article last week. I saw that still, if you get an education in health sciences, if you get an education in technical areas, computer science, and education sector also, for example, elementary level, secondary, or high school, or university. So these are the three sectors that have future. In social sciences, of course, there are many opportunities. For example, still people need people have background in finance and also in accounting, for example. These are the areas that they need. But you need to, add more technical skills in addition to your finance education, business administration education. But still, what we saw that during the COVID-19 case, many countries invited their retired healthcare professionals come and take some responsibility to, lower the burden of COVID-19. So many retired physicians and nurses, came back to the field again and trying to provide services. Healthcare, technical areas, computer science, education, and also some part in social sciences, some areas in the social sciences still have future, according to this article and also according to my experience that I can say. Still, we need more researchers in basic sciences, if you look at the field. But still, again, there are some areas that you don't need to spend time, but those areas already, for example, if you want to become, for example, if you want some responsibility to, lower the burden of COVID-19, so many retired physicians and nurses, came back to the field again and trying to provide services. Healthcare, technical areas, computer science, education, and also some part in social sciences, some areas in the social sciences still have future, according to this article and also according to my experience that I can say. Still, we need more researchers in basic sciences, if you look at the field. But still, again, there are some areas that you don't need to spend time, but those areas already, for example, if you want to become, for example, if you want to study theology, for example, you have limited opportunity, for example. If you want to study gastronomy, you have limited opportunity. If you want to study arts, for example, you will have limited opportunity in the future. Still, you are having difficulties to find jobs. So those fields are very important, but these are not widely seen areas that you can find jobs very easily. For example, if you want to be a painter, difficult. If you want, but those are important. I'm not belittling any occupation, but difficult compared to, for example, being an accountant, for example. So people need finance people, accountants, doctors, nurses, pharmacists, teachers, researchers. Still, those are the areas that still have more chance.
There's another question from same student Pravesh. What shape will the recovery be? What shape the recovery? What shape?
In the first week of November. These are people are losing their hope. Therefore, they are pumping hope. But there are rarities, because when you talk to the clinicians, when you talk to the researchers in that field, they say it is impossible to find a vaccine before 2 years early. It takes at least 2 years. Because I work in the pharmaceutical industry, I know how to develop a new vaccine. It takes 7 to 10 years. You need to have first experiments, second experiment, third experiments, later on people, and try to find try to implement the newly developed vaccine for 2 years early. It takes at least 2 years. Because I work in the pharmaceutical industry, I know how to develop a new vaccine. It takes 7 to 10 years. You need to have first experiments, second experiment, third experiments, later on people, and try to find try to implement the newly developed vaccine among different group people, try to understand the side effects. So recovery will take time. Therefore, for example, I'm saying that out of the education sector, but in terms of reaching healthcare facilities, of course, recovery will be difficult. Psychologically, all people at different levels need guidance, peer review, peer supports, families, family members, fathers and mothers know how to support children at home. So, for example, lockdowns are also having side effects. For example, after a long lockdown cases, if you see in a country, the divorce rate is going up also. So, very, very different side effects. So, recovery will not be very easy compared to other problems.
So there's a question from Deepak Bhandari, though you have partly already covered, but I'll read the question if you want to add anything on that. He has asked, hi sir, you told us that reading is important. What topic should we focus on to read to improve our knowledge and skills? So you partly replied to that. He wants to know the specific areas where you should concentrate on as far as knowledge and skill is concerned in post-COVID world.
Yeah. You need to have readings related to your area. If you are in business administration or finance, you must read, of course, your books in order to pass your courses. This is the reality. But in addition to your course books, you should also follow at least 2 main journals in your field, because you can get up-to-date research, what's going on in your field. For example, even though, for example, I'm a professor, I don't read all journals. I have some selected journals, for example. I look at the topic in that month, for example, in whichever month I am reading, in that month's issue, and choose 1 or 2 articles that I enjoy a lot, or the most interesting topics that I focus on. In addition to journal, you should also read publications provide you general knowledge. For example, Financial Times, you must read it, for example. You should read the New York Times, for example, to try to understand what's going on in the money's capital, or this is this heart of the world. If you look at, try to read the things that provide you more information about finance, economic activities, and what's going on, for example, in other countries. Don't read very local. Local are really important because you are part of local community, but read international and national magazines and journals provide you. I always ask my female students, for example, how many of you read sport pages in a newspaper? They say none. I always ask my male students, how many of you read the fashion or something related to girls, for example, in a newspaper? They say, no, you must read everything actually, because you should have more deep information, because these are already summary information. I also suggest my students, for example, whenever I meet with a student, even though at the college level, I always tell them you should have a kind of business card, even though if you are a student, because you meet with many people, but there is no opportunity to find a blank page and a pen to give you your contact information or exchange card. So you must, everyone, for example, in your institute, I don't see them, but I know that they are listening to me. All of your students or all students must have a kind of business card, because start from the first year of your college or something related to yours, for example, in a newspaper. They say, no, you must read everything actually, because you should have more deep information, because these are already summary information. I also suggest my students, for example, whenever I meet with a student, even though at the college level, I always tell them you should have a kind of business card, even though if you are a student, because you meet with many people, but there is no opportunity to find a blank page and a pen to give you your contact information or exchange card. So you must, everyone, for example, in your institute, I don't see them, but I know that they are listening to me. All of your students or all students must have a kind of business card, because start from the first year of your college. Say, for example, Adnan Kisa, student in business administration program, for example. Put your contact information, email account, and your email account must be very serious, not a kind of funny or XYZ question mark, blah blah. It should be very, very serious email you need to use, and should be a kind of, should have phone number on it, and very basic but very clean and not very complicated. You should have also kind of, if you have professional accounts, like in, for example, in LinkedIn, for example, you should have some kind of maybe website describes you, your activities, your education, provides some personal information. You can also put on this card. So communication is the key right now, but the communication is provided by using internet technology. And I always encourage students to, go for the upper level education also. You should dream about getting a master's degree, because everyone has a college degree. If you go any place, college degree is right now very easy to reach, not very complicated. You should have, you should dream about, it will have very negative effect deeply. Some countries will have minor side effects or secondary effects, or their economy will handle the corona situation very easily. But some countries will have really big problems, especially poor countries or low-income countries will have difficulty, especially in terms of finding best way to deal with the problem. So it's very sad, because some countries, people will have difficulty to reach even basic services, and I can say also food in some countries. In some countries, people have difficulty to reach some basic medicine. In some countries, people will have difficulty to reach basic education or college education. So it depends on the country, but it will take 8 to 10 years, I can say. This is also my feeling as a health economist.
Do you believe that this coronavirus is man-made?
Yeah, conspiracy is always good to listen, hear. That makes us very happy to be suspicious about all activities. But again, even though it's a man-made, even though it is a naturally happened disease or virus, it's a problem. So I think maybe there is conspiracy. They are saying that okay, it's a man-made, and also the vaccine is ready, the medicine is ready, so they are waiting time to earn money. Of course, if you watch Mission Impossible movies, these are the realities. But again, dealing with this kind of biological weapons, if you think as a kind of weapon, if you are dealing with the viruses, it is really difficult to control. So you cannot have the same experiences that you have in the laboratories compared to real field. So I don't think that it is man-made, because how I know it, because look at because corona is the general name of the virus. Flu, MERS, SARS, these are the family members of this corona. So if you think about man-made, those diseases, you can also think that are man-made. But I don't believe that it's a man-made. It's a virus. It has been in the world more than a year. This is the belief that I have. And I don't think it's a kind of biological weapon, because you look at the world, it's affecting almost everyone.
Yeah, we could have discussed a lot on this, but because of shortest time, there's another interesting data I was looking through for the 7623 at 12, this data today at 12 o'clock Indian time. 7,000 cases, 300 odd deaths. Norway, 9,700 cases, about 250 deaths. Denmark, about 15,000 cases, 600 deaths. Sweden, 83,000 cases and 5,700 deaths. So what made it bad for Sweden?
Yes. Actually, if you look at the Scandinavian culture are very similar. If you, for example, speak Danish, you can also speak Swedish and also Norwegian, and vice versa. If you
7,000 cases, 300 odd deaths. Norway, 9,700 cases, about 250 deaths. Denmark, about 15,000 cases, 600 deaths. Sweden, 83,000 cases and 5,700 deaths. So what made it bad for Sweden?
Yes. Actually, if you look at the Scandinavian culture are very similar. If you, for example, speak Danish, you can also speak Swedish and also Norwegian, and vice versa if you speak one of those languages. So they used to be one kingdom in the past, if you look at the Scandinavian area. Even though culture is same, Sweden has tried to implement a kind of herd immunity to lower the burden. They think that we don't need any lockdown. We don't need to we don't need to shut down the universities, businesses, and also schools. The country's public health policy, when they meet with the infectious diseases, such infectious diseases, based on herd immunity right now. So they think that if many people get the disease, and the majority of them will recover, but people have some kind of health problems and some kind of chronic diseases will face the problem more seriously compared to regular people. And for those people who have serious problem, the healthcare system can make intervention or can try to, help them to recover as early as possible. This is the country's policy. So herd immunity is the country's health dealing with infectious. This requires very specific precautions, because you need to provide a good cold chain for that one. Because some countries are very hot, some countries are very cold, but the vaccine is a kind of live organism that you are injecting to your body, needs to stay alive under certain temperature. So some countries really don't have this infrastructure. Some countries have. Even though some countries have a good infrastructure, but when you go to the field or village, for example, vaccine efficacy goes down because of you don't protect the vaccine under proper conditions. It's the reality. And also look at the tests that you do. Try to understand the COVID cases by taking samples from the people. They are not very positive. The results can be misleading. And also it depends on the product. For example, some tests are not very good in terms of giving the correct results. So you need to repeat the test results again, even though you say that you have a test kits, they're not very effective. When I come back to your question, what I can say when I look at the explanations made by Putin, why Putin explaining or giving speech about vaccine rather than scientific work? Why politicians are